There's a lot of burden that comes with pain. And so my biggest thing is I want people to know that there is hope, that there is a path forward, and that there are options. And so there's always going to be a way that we can improve pain. I really take the approach that there's two people making a conscious decision. We can all point to an MRI and say, this is the issue. Look at where we can put medicine or where we can treat with a medication or an injection. But at the end of the day, it comes down to what makes sense for a person. My first meeting is largely talking with people, understanding their story, their journey of where they've been, what they've had to go through, and what they've tried. And it doesn't make sense to recommend more injections or the same medications that haven't worked. And so always looking to see, is there a different option that might not have been approached or a different way that we can account for what the person's been through. When I talk to patients about regenerative medicine, we're shifting that dynamic from what gets relief to what fixes the issue long term. And this also allows us to avoid surgery. And so for a lot of joint conditions, surgery in the back, things like that, we can avoid major surgeries by using regenerative medicine. So outside of medicine, I'm a dad, I'm a husband. And so a lot of my time outside of work is spent with my two little boys and my wife. And so we love hiking, we love fishing, we love generally being outdoors. That's one of the big things that drew us to Colorado. So I'm originally from Alabama, and we jumped ship a little over a year ago because we found all of our time was spent coming out here and enjoying the mountains anyway. So might as well be here. I find treating a patient and having them come back in months and seeing them be able to tell me, I was able to do this. I was able to climb whatever mountain that they wanted to, or I've been able to play with my grandkids and I haven't been able to sit on the floor and play with them in months. That's huge. We're here to take time. We're here to understand where you are. We're also very used to working with physical therapists. And it's one of the reasons I like our physical therapy team, because we have in-house physical therapy where I can walk next door, talk with our therapist, see how you're doing, and change the plan. And so I think the big takeaway for the difference between physical medicine and rehabilitation versus just standard pain medicine is that we're following you on this journey, not just writing medications.